Hello everyone, my name is Amandeep and today I'm going to present a peer group interview video and Shelly gonna ask me some question and I will try to answer it.
Okay. What forces you to apply as emergency room nurse in Sunnybrook Hospital?
According to me, I'm really good and capable enough to take this position as an emergency nurse department because I'm having experience of 2 years back home because while I was working in that area I'm really good enough with the critical handling with the critical situation, and just because of that I'm able to work in a high pace work environment, and just because of that I think I'm really good in this. I'm also having some leadership skills because I'm also having 1 year of experience in leading team and in the emergency department, and just because of the environment of the emergency room, I think I can be good with these skills because I'm also having a good communication skills too.
Okay. Tell me, if you are in a critical situation while handling a patient, how would you manage the situation?
In the emergency department, we are dealing with the different patients who are suffering with the life threatening conditions, and just because of that condition, some people we can say some clients are really troubled with their behavior, and because of their different culture, they are having problems with communication. They are having some aggression just because of their health condition, and while handling these kind of situation I will be able to cooperate with that patient. I can use myself with the calm, and just because of the calmness I think I'm able to handle that kind of patient, and I can listen that patient that what they want to say. I'm able to try to manage all the condition, and if I need some help I will try to explain with with my client, and I think these are capable enough to be a good emergency nurse department.
Okay, Anand, which techniques do you apply to manage uncooperative situation in an emergency room department?
Okay, as I am having experience in emergency room department working condition, in that area we are really busy with the hectic condition, and just because of that we have really busy with the workload, and I think in that kind of situation we are able to have situation like conflict and really unable to manage uh, with the team working condition, and in that kind of a situation if I am a leader I will able to manage all the situation with the calm, and I can use my critical thinking so that I can analyze all the things and solve small problem at the same time and then go forward for the bigger one. And I can encourage my team members so that we can work in a good team so that we can achieve a specific goal, and divided our work condition, divided our workload in a different members so that we are able to achieve a good goal in a specific time.
Okay. What do you think about the challenges you have to face while working in the clinical areas?
Challenges like I want to share my experience while I was working in the ICU too, and in that kind of situation, normally we have 1 to 1 ratio. So in that, once upon a time when I was working with the several clients, because there is a critical situation, I'm having really critical clients at the same time, and that time I motivate myself. Even I make strength. I will give my given strength to myself, and I go with the positive reinforcements that I can do it and I can manage all the situation. So on that time I manage my patient who are really sick to so that I can give the I can give I can provide effective care to save their lives according to the priority.
Okay. Why do you think you are capable enough of taking this position?
I think because I think I meet all the requirements and that is necessary for emergency nurse to have. And I'm also having 2 years of experience with these kind of situation. I'm really good with these. I'm also certified with from my hospital that I'm good with these task management skills. And I think these skills are enough for me to have this job capability.
Okay. So, describe a time when you cared for a patient with values, beliefs, or morals that conflicted with your own. How did the situation affected your relationship with patient? How does having a diverse workforce benefit the hospital?
I vividly remember this kind of situation once upon a time when I was working with my client who's admitted in the emergency department. While stabling the condition of the patient, I was transferred that patient to the general department, and when I transferred that patient, I'm going to over giving the over to other staff. And that time there is a cough syrup because my client was suffering with the really bad cough. And that time I told my client that this is the cough syrup that is prescribed by the doctor today, and you have to take this. But after this, my client's families negotiate that thing because they said that allopathy is not good enough instead of their homemade syrups. And these kind of things really give me some confusion because this because they were preferring home remedies over the allopathy. And I didn't think anything, I didn't told them anything because I prefer that is that is their wish to have a treatment as they want. So I'm okay with their moral values and the things, but I'm happy with all because I didn't conflict with the client and their family, and I didn't because I didn't violate their rights. So these are my this is my experience, and thank you so much for this.